So our aim is to make this town hall more interactive. So please, if you're able, share your camera. We'd love to be able to see your face. And then if you have any questions, please feel free to chime in at any time or chat those, and we'll get those addressed. So today we'll be talking to Katy Bunder, President and CEO, and various program staff about steps towards ending hunger in the United States. With us today, we have Adam Meyer, our Senior Impact Director. Hey, Adam. Kevin Boyd, Impact Director. Kier Crites, Chief Engagement Officer. And Katy Bunder, President and CEO. So first we'll go ahead and talk to Katy. Hi, Katy.
Hi. I recently read an article by Craig Gunderson stating that we could end hunger in the United States with just a few steps, that it was really in reach. And I thought that might be a fun topic to talk about today. So, in this country, ending hunger in a few simple steps seems pretty impossible, but let's see what you think.
All right, we're going to launch a poll. So do you think it's possible to end hunger in the United States? All right, that's great. So everyone is saying yes, that we can end hunger. So that's awesome. Katy, can you talk to us more about this article?
Sure. So the author of the article is a professor of agricultural economics at the University of Illinois. He's been researching and writing about food insecurity for the last 25 years. He points out that eradicating hunger is an investment worth making because the cost of not ending hunger is very high. What are the costs of not ending hunger? Poor health for the poorest Americans, poor mental health, lackluster job performance, and in the case of children, academic problems and lifelong emotional problems can result from food insecurity. Gunderson claims that eradicating hunger is within our reach because we have the best agricultural supply chain in the world, and we have the Supplemental Nutrition Assistance Program known as SNAP, previously known as food stamps, in place already. With these two realities in place, a robust and sustainable food supply chain, and a government program designed to reduce food insecurity, we are set up to end hunger. First, we'd have to maximize the maximum SNAP benefit would need to be increased. What do you think the current SNAP benefit is for a household of 3?
All right, we're kind of all over the board on this one. We have 5 people answering 150, 4 people 509, 1 person saying the max benefit is 800. And it's actually 509. So we're going to talk to Kevin a little bit more about the maximum SNAP benefit and kind of the average benefit that households can receive.
Oh, can everyone hear me?
Yes, we can.
Okay. Yeah, I'm looking at some data before this presentation. This is as of 2019 fiscal year. In Indiana, as Kyle mentioned, the max benefit for a family of 3 is 509. That gets reset every year, usually at cost of living adjustments. So we can expect that the next fiscal year after the current will probably bump that 3 household family up to maybe 535, 540. It's usually somewhere 3 to 4% cost of living adjustment, I guess, would be the easiest way to put it. But in particular, in the state of Indiana, about 74% of SNAP participants are in households that have children, and more than 33% are in families with members who are elderly or might have some kind of a disability. So, but interestingly, nearly half, like 45 to 47%, are also in families that are working families. And obviously their wages are such that it's not a living wage, that they just have all the options available to them. And And usually it comes down to food versus medicine, food versus utilities, things like that. So it's a sad situation. But it's very real. It's very, much on people's minds every day that are in this type of position. And, as Katy mentioned, there's got to be ways to fix this program. And it's not just a one size fits all. It's going to take a lot of work from a lot of us.
So Kevin, I just want to highlight, SNAP isn't meant to cover the household's whole food budget, is it?
No, it's a supplement, as evidenced by the actual acronym, Supplemental Nutrition Assistance Program. It's not a complete fix. Obviously, if a working family has an income as such that they don't qualify for SNAP, they are probably potentially in a worse situation than a family maybe $1,000 a year less that actually does qualify for SNAP. So it's definitely not going to fix everybody's problems. The average SNAP benefit in Indiana for a family of 3 is somewhere between $350 and $415 a month. And I'm just speaking for myself, $300 to $400 if I were a family of 3, that's not going to get it done. So groceries and the like are always rising. So
okay, great. Katy, can you talk to us more about raising the maximum benefit and what that could look like?
Right. According to Craig Gunderson, if those receiving the maximum SNAP benefit got just $160 more each month, we'd instantly see a 60% drop in food insecurity. SNAP benefits have been increased by 15% during the pandemic. Why not leave that benefit in place to reduce food insecurity all the time? The next step to ending hunger in this country would be to expand the eligibility for SNAP benefits. Millions of Americans, as Kevin mentioned, have incomes that are too high to receive SNAP. SNAP benefits in Indiana, only 52% of the food insecure people are not eligible for SNAP. So let me repeat that, 52%, more than half of the people who live with food insecurity aren't eligible for SNAP benefits. Their only resource is the food bank or food pantries that work with us.
Wow. Kevin, can you talk a little bit more about what eligibility might look like for, say, a household of 3?
Sure. This quoting Indiana guidelines, but they're very similar across the country, with probably a few exceptions in very high cost of living states like Hawaii and California, maybe New York as well. But for a family of 3, SNAP eligibility is determined first and foremost by gross monthly income. But if you meet that guideline, you also then have to meet what's called the net monthly income to then move forward to qualify for benefits. For a family of 3 in Indiana right now, it's right around $2,350 a month gross income, obviously before taxes. And the net monthly income has to be $1,810 or lower. So if you break that up over essentially a 4-week month, your net income can't exceed basically $450 a week. And we can think of a myriad of things that we got to spend money on, and food being a big piece of it, but certainly rent or utilities, medications, kids' lunches, and the like. So it's an extremely low number, and that number equates to about 130% of the poverty guideline. So it's, I think, absurdly low, but it is what it is, and it's been this way for years.
And Kevin, as it relates to eligibility, what about assets?
Okay. A family that does not have a senior in the household, a family cannot have more than $2,250 of assets. So you think of a two-parent family with a child, theoretically, if they have an extra vehicle that's just kind of considered luxury, that disqualifies them. If they happened to be very frugal and put more than $2,200 in the bank, you know, for what ifs, they're not eligible. That number goes up a little with a senior in the household. A senior applying for SNAP can have, get this, assets as much as $3,500, which is ridiculous as well. So, you know, the bar is set to not allow a lot of people to succeed in getting the benefits that need it the most.
I want to just jump in here. One of the things that strikes me is how high medical deductibles are now. So that family of three couldn't have enough money to save to pay the medical deductible if they needed to go to the hospital for anything. And the same thing with the senior citizens. That $3,300 isn't going to cover if you have to go have your appendix removed, what you'll have to pay out of pocket to the hospital. So we're really setting people up to fail at managing their finances.
Yeah, that doesn't really allow for much saving, does it? Katie, can you go ahead and talk to us more about Gunderson's recommendations on expanding eligibility?
Sure. So the next thing that Gunderson recommends for ending hunger is raising the gross income threshold to 200% of poverty. What we've been talking about is a threshold at 130% of poverty. So raising the threshold to 200% of poverty would mean that that family of three could make $44,000 a year. And the asset limit, if it could be raised to 25,000, this would let the SNAP program work as it was intended to work when it was invented in the 60s. And that was to be a method for people to climb out of poverty, a program that helps end poverty and get people on a stable footing. And we've chipped away at it for so many years now that it no longer acts that way. It's really just basically for the poorest of the poor, a safety net that doesn't have enough food. So, so the cost of, if we did this, it would move millions of people out of food insecurity, millions of people. And the cost would be approximately $70 billion. But let's consider the overall economic benefit from SNAP, not just the price tag for increasing the number of people on SNAP.
Thanks. I think we have Adam here to share a little bit on the economic benefits of the program.
Yeah, so it's been proven that SNAP provides quick support to local communities. So every $1 spent with SNAP generates more than $1.70 towards economic activity. And so you're getting your bang for your buck, almost double the amount per dollar spent through SNAP. And the other thing about, you know, we're in the pandemic now, and Feeding America projects that the unemployment that resulted from COVID is going to raise the food insecurity rates up to 1 in 8 adults, and then 1 in 6 in children. So, you know, that's going to have a huge impact as we move forward. And, you know, as we're kind of seeing the light at the end of the tunnel a little bit, prior to COVID, 75% of SNAP households had at least one worker, and 33% included 2 or more workers. So that just goes to show you that, you know, people are trying to make ends meet out there, but, you know, they need as much help as possible. So although their income wasn't high enough to provide adequate food for their household, that kind of really speaks to the living wage that we're kind of, you know, looking at and identifying now.
Okay, great. Thanks, Adam. You know, I think Kevin touched too on who does SNAP help. So I think, Kevin, you said 76% of SNAP benefits go towards households with children. So, you know, that's huge. And about 10% go to households with senior citizens, and about 11.9% go to households with disabled persons. So the program really does help a lot of people that need it. I think, Kier, I'd like to defer to you. How does SNAP help food finders and our partner agencies?
Yeah, I think as Kevin said earlier, it is meant to be supplemental. But with the way the current restrictions and things like that are in place, the burden really is on the food banks and our partner agencies and our Feeding America network to provide the bulk of food to people who are needing it. And, you know, if the maximum was allotted and people could receive more assistance on SNAP, that would really greatly reduce the burden on the food banks across the country and our agency partners as well. So that's why, you know, that's why we advocate for it. Of course, it's the right thing to do. For every one meal that we provide, SNAP can provide 12 meals. So it's much more efficient to give people SNAP dollars. You know, they can turn that into a lot more. The other thing that we believe, you know, we always believe in choice and dignity, and not only does it stimulate our local economy and things like that, but it allows people to go out and choose the foods that they want and that they need for their families. Emily Weikert Bryant on here has a fantastic PowerPoint and presentation that she gives on SNAP myths that I would encourage everyone to watch at least once and kind of be able to be out there combating those myths, because it's literally impossible for someone to use their SNAP card to buy cigarettes or alcohol or things like that. That's what we so often hear from those things. But yeah, we just want people to be able to buy the food that they need. And one of our education programs is often around the topic of, so say you're getting the minimum amount of SNAP dollars a month, $15, and you have that to go to the grocery store with. We work with our clients to help them identify, you know, go to the grocery store and buy the more expensive items or the things that we don't normally have at the food bank or consistently at the food bank, like eggs or butter, cheese, things like that, and then use the food bank to supplement what you get. So that's our take on it.
So yeah, so we've talked about increasing the SNAP benefit and then also expanding eligibility as the first two steps. Katie, what was the third step that Gunderson recommended in that article?
Before I go on to the third step, I just wanted to talk again about the economic benefit to everybody of SNAP dollars. And the proof that SNAP is an economic stimulus is that the people who lobby Congress for SNAP benefits to stay where they are or be increased are the big retail grocers, because it's Kroger and it's Walmart, because they know that they will benefit not just from the money that is on the SNAP card, but from everything else that the people who use SNAP will be buying in their stores. It's a huge part of their business. But on to the third step. So the third recommendation that Gunderson makes is that we need to keep farm prices stable and not impose any regulations on the farming industry that will cause prices to go up. Because if they do, then the first two steps won't work, because food prices will still outstrip the increases in the SNAP benefits and people will still be food insecure. So some of the ideas that have been batted around with the Biden administration have been to require more sustainable farming practices. And if that happens, then there needs to be either an increase, if there's an increase in food, there needs to be an increase in SNAP benefits, or there needs to be a farm subsidy to offset the cost so the food prices don't go up. So that's his third step in eradicating hunger. But one of the things that I didn't mention earlier is the cost to our government to support children who don't learn well, sometimes for their whole lifetime. And what do we spend in Medicaid dollars for those who've lived their lives in food insecurity? If we ended food insecurity, would it reduce diabetes, high blood pressure, obesity? What is the cost of leaving the food insecurity rate at the current level?
Well, thank you.
So this is what it would take to end hunger in America. Would you support doing this? I'd like to know why or why not.
So we're open for discussion if anyone has any questions. I think Joe Howarth was wondering when the SNAP thresholds were set. Kevin, can I defer to you for that?
Initially, or I think, as Katie mentioned, in the 60s, yes, it's a little over a 50-year program at this point. However, obviously, the poverty threshold that it's been set at, that 130%, has not anywhere near kept up with true reality and what a poverty number really looks like. So I don't know how economists can make their calculations to make us think that this is a legit number, and it truly isn't. I would just go one step further. In Indiana, if just talking about a two-person household, you can have a husband and wife that are both working a minimum wage job, $7.25 an hour, and they don't qualify for SNAP. They're above the limit on the gross income. So is that equitable? Not even close. So definitely there's some changes need to be made to these numbers.
Yeah, again, I think, 52% of the food insecure in the state of Indiana are not eligible for the program. Just going back to that data point is, sobering for sure.
Kier, you might have said this, but did you speak to how our numbers drop when people have cash on hand?
No, that's a great point, and Adam can add to this as well. But right now with, generally every tax season, or when people start getting their tax returns, we start to see our numbers drop quite a bit in the food pantry. And this happens across the country, and you can directly correlate that to people getting their tax returns back. And no one wants to use a food pantry. So if they have cash on hand, they definitely much would rather go out and go shopping for themselves. We're seeing that right now again as well with some of the stimulus checks that have gone out.
Everybody would like to choose their own food. And that's what we see happening. And that's why an increase in SNAP benefits, it would help us because we wouldn't have to buy so much food or obtain so much food, but it would also really help the individuals that are trying to get out of poverty have a little more dignity in their food selections, because they could choose what they wanted instead of taking what we have.
Katie, I think I've heard you say this over the years. I think it was, and Feeding America talked about this a lot during the recession in the mid 2000s when I first started at Food Finders. Prior to that, it was not normal to go to a food pantry as often as people do now. And during that time, it really switched where food pantries were viewed more as an emergency only type of thing, to where, it became quite common for people to need to go to a food pantry once a month, once a week, things like that. And we really have never seen that go away since the last recession. And now COVID has completely impacted that again.
Another thing that happened when the 2008 recession hit was that there was a whole group of people in their 50s and early 60s that had, not great jobs, but they were working people. And when they lost their employment, their age, their physical ability, and various other, the fact that they probably weren't very computer savvy, the jobs that came back weren't jobs that those people were eligible for. And so they ended up just taking early retirement at 62, sort of guaranteeing that they would then be in poverty as senior citizens. And I'm really worried about that happening again with the COVID economic downturn. I think the economic impact of COVID will exist for a lot of years after the medical part of it is solved or contained, because we're going to see people that lost a job, just thinking about a restaurant that goes from being a restaurant where they have waiters and waitresses and lots of cooks to being a place that only has takeout, or people that worked in movie theaters. Who knows if all of the movie theaters will come back again. So there are going to be a lot of people that have been displaced from their employment, and for various reasons will find it very hard to find another job. So we're going to be feeding those people for a decade, I think, just like we have with the people that lost their jobs in 2008.
Joe would like to know how SNAP can provide 12 meals and the food bank can provide 1.
Adam, can you answer that?
Well, with the SNAP, you've got the ability to go into a store. So with taking that money into a store, you're going to be able to use those dollars, but at the same time, you're also purchasing other things and more food. And so by, having the ability to go into the store knowing you have some money to spend that's, being provided through SNAP benefits, you're able to use any other supplemental money that you may have that you've set aside for food to kind of expand that a little bit more. So that's, to me, how, SNAP kind of impacts the amount of meals that you can get per dollar.
And I think that calculation comes to us from Feeding America. And I think probably to the food bank, we have a lot of costs wrapped up in sourcing and storing and transporting food as well.
There are probably also people that use SNAP benefits that don't use the food bank. And so that would contribute to that too.
That's a good point, Kyle. And I think I said it wrong. It's for every one meal the food bank can provide, SNAP can provide 12.
Emily Bryant, do you have anything to add?
Katie, I think she's in transit, so I'm not sure that.
Oh, okay.
Oh, there she is.
It just landed.
Oh, good. Thanks.
Yeah, sorry, I was at the State House this morning. Now, you all have done a wonderful job, and I think Dr. Gunderson is really right on in that, the programs are not meeting the need, and they're not providing what families need to get through. One of the things that was in the last farm bill that this administration has really sort of doubled down on is looking at how they calculate the SNAP benefit level. It's a really cumbersome multi-step process where they determine the benefit levels based on something called the Thrifty Food Plan, which is a number of items that they price at retail to determine what the best price is. And they go with the lowest price to set that basket amount for the Thrifty Food Plan. The notion that, an individual using the benefit, or any shopper for that matter, is going to go to as many different retail places as they can to get the best price on those specific items, I don't think it was ever really the case. And so the ask was to look at a low cost food plan, which is sort of the next step up in determining benefit levels because it's more realistic. And that's something that Congress expected for the USDA to do, and the Biden administration is taking a serious look at that to talk about benefit adequacy, which is a big issue with staff.
When we go to Feeding America conferences and talk to other people who help people get on SNAP benefits like we do, it seems like it's harder for our clients to get on SNAP than it is in other states. Do you think that's true?
I've heard better and worse. So I think it always could be better. It always could be worse. I will say with the pandemic, we have seen a lot of waivers that the USDA permits and continue to see. So for instance, when the pandemic hit, the work requirement for the time limit for able-bodied adults without dependents was suspended. And that continues to be suspended to the USDA through September. That, I think, helped a number of folks access benefits who hadn't been before. I think what we're looking at now is how do we resolve that problem when we're running out of waivers. I think there were a lot of options that the state was able to provide with the USDA's approval that helped families access SNAP when they had not been on it before the pandemic. But there's always ways to streamline the program. So one of the things that we're actually working on with the state that came out of Operation Food and the Food Access Task Force was, how do we simplify the waiver notices? If someone's denied benefits or they're interacting with a state agency at all, they're getting some sort of notice, and there are requirements that have to go into those letters, and they're written in ridiculous legalese to where I could read it and not tell you what it means. And I do this stuff for a living. So for, normal people, for families who are looking at that, they don't really know how to interpret it. They don't know what it is that they've been doing, that they need to do or what they need to change. And so we're working with FSSA, and they're really willing to go through their notices to determine where we can help clients better. And quite frankly, it helps them on the back end because it means they're not getting as many calls. They're not seeing as much churn or people having to drop off and reapply. And it makes their job easier.
Yeah. Has there been any progress made in the fact that our clients have to have to fax documents to FSSA?
They are working on that. That was one of our
I've
asks.
been working on that for 5 years.
At least, yeah. And part of that was the transition to their new system. So they now have the whole state transitioned to the new application system from a legacy system that was, imagine the green screens and the dots. It's kind of what I was expecting it to be. They've got that going on. They've just recently started texting and emailing clients information, which tells me that technology is there. So one of their asks as part of this rollout was for clients to be able to text or email. So we will continue to push on that.
I think some young people that apply for SNAP benefits have never even heard of a fax machine. And then they're told they have to fax their documents in. We help a lot.
I would imagine you wouldn't have a fax machine if you weren't doing application assistance.
Right.
Yeah, Adam, that's a good segue into resource coordination and our SNAP application assistance, if you want to touch on that. Or Kevin.
Yeah, so with our resource coordinators, that's really the kind of first thing we work with our clients on, you know, especially with COVID, when that first hit, we were seeing a lot of new, you know, households that have never experienced this type of situation before. So they were looking for help on, you know, navigating all the available resources. And so our resource coordinators, that's one of the first things they do is kind of just, you know, ask, you know, simple questions about what, you know, how big is your household? What is your guys' income? If they've, you know, been recently laid off or lost their job, we can sort of talk with them and help them apply fairly quickly. And then one of the other goals that we, you know, try to establish with resource coordination is not only helping people apply for SNAP benefits, but also explaining to them what they can expect when they, you know, actually submit their application. So we work with them on letting them know all the different types of documents they'll have to get together. You know, like it's been discussed, we help them fax those documents off. So we try to give them as many tools as possible to complete their application so that they are able to get those benefits. So often, you know, you have people that are interested in receiving the benefits, you know, they'll apply, but then when it comes time to have to submit their documents, that can be a real barrier. And so we're trying to remove as many barriers as possible so that people can get the benefits that they qualify for. So they don't find themselves, you know, falling deeper into a crisis situation or, you know, having to, you know, scale back their lives any more than they already have. So that's one of the first things that we do is, you know, not only ask them about SNAP, but other benefits as well.
Joe's asking for resources for our resource coordinators. Are we working with Homestead on rental assistance for your clients? I know we do with the education program, they teach classes. They probably are a direct referral for us, for our resource coordinators.
Yeah, they are a really great sort of teammate of ours. They, like you mentioned, they come and teach classes, but they're really great to work with as far as making referrals. And it's easy for us to kind of contact them and kind of explain, you know, a client situation so that it's a smooth transition from a client visiting our fresh market to possibly setting up an appointment with Homestead.
Joe, you're exactly right. If they can get rental assistance, then that means more money in their pocket for food or for other necessities. And that's what we're all trying to do.
Homestead is one of the local agencies that's got the federal money and state money for rental assistance. So truly, they've been trying to get the word out. So as you guys run across your clients that say, hey, I got to pay rent or I got to pay utilities versus my food, get them to Homestead, because I think Marie and her team can help that substantially.
All right, does anyone have any other questions?
I have one more question for Emily. What do you think the political, when or how do you think we would ever have the political will to follow the plan that Craig Gunderson lays out?
That's a great and loaded question, Katie.
And thank you for coming on so I could ask it to you.
Absolutely. No problem. Sorry. I was in the car for most of that. You know, I think when it's understood, and I think it's well explained, talking to our elected leaders about hunger, the impact of hunger on Americans and on Hoosiers, and the ways that we can solve those issues, it's a wise investment. Providing food access to Americans improves their health outcomes, improves our healthcare costs, improves education outcomes, you know, general well-being and mental health.
And probably the job outlook.
Absolutely. It's really hard to do that calculation though, you know, so it's difficult to say for, you know, we can calculate the economic impact. How do we calculate the social impact and the health impact on those benefits? And I think we talk more and more about that all the time. I think the better we're able to explain that, I think the more reasonable of a sell it is to say, we're going to increase the threshold for SNAP to 200% of the federal poverty level, which is really about in Indiana the self-sufficiency rate. It's about that level where you can probably provide for your families without any assistance, you know, or we make sure that the benefits are substantive enough to allow people to buy healthy food that they need. You know, a lot of the options that are affordable, and with a benefit like SNAP, you want to get the most for what you have. A lot of the options that are most affordable are not the most healthy. You know, and we want them to have choices, but we want them to have more choices than just what is the cheapest thing that they can buy. Yeah. And I think having a stable ag economy is very important. It's something that we've seen over the last few years with some trade issues where it's been, you know, the prices of food, what's been sold, what's been, you know, sent overseas has been extremely disrupted. Between that and the pandemic, we saw a 50-year high in food prices last year, which hurt our clients. It hurt the food banks who were purchasing food. It hurt the federal government in their programs as they were buying food at different levels and price points as well. And so having more stability enables to better prepare and to have more opportunity and to make sure that the prices are sound. So I think what Dr. Gunderman recommends are all on point. Yeah. And I think we just have to keep having those conversations with our elected officials to make sure they understand it as well.
Anyone have any other questions or comments?
I think I'd like to add, just from more of a local level, an encouraging thing with farmers markets. They've started accepting SNAP dollars at local farmers markets, and you get to double your benefit. So if you go to a farmers market and you're spending $15 on fresh produce, with SNAP dollars you can actually get $30 worth of more healthy foods. You're helping yourself, but you're also helping a local businessman too. So it really adds up, and the more play-in that gets across the country certainly would be beneficial to everyone.
Well, that's a great program. We love that program. Well, if no one has any other questions, I think that's a good spot to end here. Again, Emily, thank you for being with us. Emily Weikert Bryant is the Executive Director at Feeding Indiana's Hungry. I'm so happy to have you and everyone else on this call today. We will be recording it. I could probably send that out to all attendees, and then we will post it on social media or on our website. So thank you so much, everyone. Enjoy the holiday weekend.
Thank you.
Goodbye.